I wanted to talk to you about what fatty livers are. Uh, the medical term for fatty liver is non-alcoholic fatty liver disease, or NAFLD, or NAFLD. A lot of people have this condition, but nobody knows about it because uh, we don't usually screen for this devastating disease. Fatty liver is a condition that can be very, very devastating. It is a disease where, just like the name says, where extra fat is deposited in the liver, um, and uh, and this excess fat in the liver can lead to chronic inflammation, and this chronic inflammation leads to scarring and damage. A stiffening of the liver, just as if you had been drinking a lot of alcohol, but you didn't. So you could have the same damage that you would have from fatty liver as just as if you drank alcohol. But with this chronic fibrosis happening over a long period of time, perhaps 10 or 20 years, it can lead to liver cirrhosis, which is an end stage liver disease, and you're going to need a liver transplant to live. In fact, fatty liver is the number one reason for liver transplants in America for women, and it's number two for both women and men, which is very surprising because that means it is right up there. It causes more liver transplants than hepatitis viruses and liver cancers and alcoholism. And this is literally a public health crisis, in my opinion. It's a it's a silent killer, just like high blood pressure. If high blood pressure is it goes on for a long time, it can lead to bad outcome for patients that are undiagnosed. And it's the same for fatty livers. So when these fatty livers turn into fibrotic livers, it's called non-alcoholic steatohepatitis. So the or NASH. So the NAFLD progresses into NASH due to the inflammation. Um, and so typically people find out about this when it's too late. Either if it's too late or they found out about it by accident because their doctor ordered a liver imaging scan through CT or ultrasound for some other reason. The reason why we don't test for these or screen for these is due to the fact that there is no treatment available for patients, for regular patients, but the treatment is only available through clinical trials. So your regular doctor cannot write you any prescription to treat this devastating condition. And another reason is because the insurance companies don't pay for the screening imaging studies because there is no treatment for this unless your doctor orders it for some other reason. So typically people come to our center because they found out about it by accident, or they heard about it through watching our video, or somebody told them about it. Um, so um, so the imaging studies that your doctor orders, whether it's CT or ultrasound, has its limitation. It can tell you whether you have the fatty liver, but it doesn't tell you how bad it is. And so the only machine that can tell you without getting an actual liver biopsy, which is invasive and can be quite uncomfortable at times, is through this machine called FibroScan. And the FibroScan is able to not just screen for the disease, but also tell you how bad it is, how much fibrosis you have in your liver. And at Jubilee Clinical Research, at our research center, we offer free FibroScan liver screening. If you if you would like to have it. You don't even need doctor's referral to get an appointment for this free exam. Um, and typically, the people that should get this FibroScan screening are people with risk factors. If anybody has any one of these risk factors, doesn't have to have all four of these, but if you have first obesity, that obesity translates into fat deposition in the liver. And you don't have to be morbidly obese, just a little bit of overweight can put you at risk. So you should get checked out. And a second risk factor is hypercholesterolemia or high cholesterol, which makes sense because cholesterol is fat and excess amount of it can deposit in your liver. Another one is diabetes. If you have diabetes, it's a condition where your sugar is always elevated in the blood, and that excess sugar turns into fat and deposits in the liver as well. And lastly, the um, the fourth risk factor is high blood pressure or hypertension, which has been associated with the other three conditions. So if you have high blood pressure, that puts you at risk as well. So if you have any one of these risk factors, you should come in and get a free liver scan. Um, and there's two other risk factors, but you can't do anything about that. One is age. If you're older, you have more time to damage your liver. So people who are older tend to have uh, uh, later damage or more advanced fibrosis. And the sixth risk factor is genetics. You got it from your mom and dad, and you can't do anything about that. But the key to combating this devastating condition is early diagnosis and prevention. And if you happen to have significant amount of fibrosis, we do have treatment through clinical trials at our center. So we were here to help you. If you have any of these risk factors, please come in. Thank you.